Adults with these symptoms should see their physician. Fifth disease can also be a problem in pregnancy. A pregnant woman who has been exposed to this disease should call a physician. Extra monitoring for both the mother and baby may be recommended. Gastrointestinal germs can cause problems with the stomach and intestines. Those problems include vomiting and diarrhea. Vomiting or diarrhea can be caused by a number of different germs. The goal is to stop the chain of infection. When vomiting or diarrhea are caused by an illness, we strongly recommend that the student or staff person stay home. The best prevention is hand washing. Hepatitis A is usually not a school problem, but it can be a problem if you travel. If you are planning to travel to another country, please talk to your doctor about the possible need for a hepatitis A vaccine. Lice, scabies, ringworm, conjunctivitis, impetigo, and herpes are bugs and germs that can cause infections and skin irritations when there is direct contact. Direct contact means that you need to touch the infected area to spread these diseases. Head lice is a common bug that can cause irritation. They do not jump or fly, so a person has to have direct contact to become infested. Head lice are a nuisance, not a crisis. Parents should follow specific instructions for treatment. Treatment usually includes use of non-prescription shampoos and conditioners. An important part of the treatment is to comb the nits, or eggs, out of the hair. Parents can call the school nurse for information that has been translated into other languages. Scabies is a little bug that gets under the skin and causes it to itch like lice. It is not typically spread in the school setting. Ringworm can be a problem for athletes. It is important to clean workout equipment. Conjunctivitis, more commonly known as pink eye, can be caused by a virus or a bacteria. If the eye is red, watery, and the fluid is clear, it is usually viral and is no more contagious than the common cold. If there is thicker, yellow drainage from the eye is most likely infected with a bacteria, and a visit to the doctor for an antibiotic eye ointment is warranted. Impetigo is caused by a bacteria. A student can be in school if the areas are covered. Often it is best to see a doctor for this infection. Herpes is also called cold sores. It is transmitted through touch. If you have cold sores often, you may want to talk to your doctor. There are some prescription medications that can help. A blood-borne pathogen is a specific virus that is spread through blood or other body fluids. Hepatitis refers to a disease that affects the liver, and the letters A, B, and C refer to a specific virus. HIV, the human immunodeficiency virus, causes AIDS. Hepatitis B, hepatitis C, and HIV are spread by blood and bodily fluid contact. A person can be a carrier of hepatitis B or C and HIV and not actually become ill for several years. Exposure to these viruses are usually through sexual intercourse or IV drug use. The risk of being infected in the school setting is very low. We need to treat all blood and bodily fluids as if they were infectious. It is important for all staff to report any blood-borne exposure. Assume that all blood and body fluids contain germs that are contagious. Most often risk is low, but our goal is your personal protection. It is important that we all understand the nature of the infectious agent so to prevent or minimize the possible exposures. We do not know who is infected because staff and students have privacy rights under state and federal law. Exposure to blood can occur through an open sore. The skin is a barrier, but if there is a cut on the hand, blood can get into the sore. Another possibility is a bite that breaks the skin. Hepatitis B could be transmitted. A needle stick and a splash of blood to the eyes, nose, or mouth are also potential risks. A person has to have the virus to spread any of these diseases. If you believe you have been exposed to another person's blood in any of these ways, you should report this to your supervisor and then to health services. Recommended immunizations for adults include tetanus and diphtheria, varicella, measles, mumps, rubella, and in some cases, hepatitis A and hepatitis B. These are vaccines which are particularly important for increasing prevention for ourselves. Another way to protect yourself is to create a barrier between you and the infectious agent. Gloves are a recommended choice. If you are without gloves, use something as a barrier between you and the body fluid. A stack of tissues or paper towels will create a barrier. Custodians and special education paraprofessionals have access to protective smocks, eyewear, and aprons. Gloves are available in your building. Make sure that the gloves you are using fit and they are of the right material. The district provides nitrate and vinyl gloves and avoids using latex gloves due to potential allergies. Because blood and bodily fluids can be infectious, the custodians use a special procedure for cleanup. If you see blood or bodily fluids like vomit, please contact a custodian or your program facilitator for help.